This video will demonstrate the procedure for administering subcutaneous injection and an intramuscular injection. The nurse will be administering 0900 meds to Mike Tyson. The nurse will first complete hand hygiene. She will then get the correct chart from the chart rack in order to check the doctor's medication orders against the orders in the MAR, or Medication Administration Record. Each medication order is checked from the top to the bottom on the MAR while looking at the most current doctor's orders on the chart. Be sure to look at all the pages of the MAR for medications. Take the patient's identification band off the chart and place it into the drawer to use when in the patient's room. The process of checking the MAR to the doctor's orders, pulling meds from the Pyxis, and performing the first and second check is the same as in PO medication administration. Once the first and second checks are complete, put the medication in the drawer. Never leave the medications on top of the wow. Minimize the screen before leaving the med room. Leaving the screen open is a violation of the HIPAA law, which protects the patient's right to privacy. The nurse will now go to the patient's room. The nurse is now in the patient's room. She will perform hand hygiene, open the MAR screen, and identify herself and the patient.
Good morning, I'm Sharon Pulano. I'm a student nurse from NCCC. I'm here to give you your injections. Can you please tell me your name?
Mike Tyson.
Date of birth?
3/12/1958.
Any allergies?
No, I do not.
Thank you.
Check the MAR screen and make sure that the box in the upper left-hand corner is highlighted before scanning the bracelet.
Can I see your bracelet, please?
The word no changes to yes on the screen after scanning the bracelet. This lets you know that you have the correct patient. Complete the third check of meds by scanning the meds. Be sure that the box is highlighted correctly. Explain to the patient that they have their Procrit injection. You may ask them where they would like the injection or where they had it the previous time. This patient would prefer the injection in the abdomen. So we'll prepare the medication using a 25 to 27 gauge needle, 5/8 to 1 inch. Remove it from the drawer. Take the syringe out of the package. Make sure that the needle is secured to the syringe barrel. Figure out your math dosage from doctor's order to what is on the vial bottle. The order is 3,000 units. On hand is 3,000 units per ml. You will need 1 ml of medication. Use an alcohol swab and clean the top of the medication vial. Take the cap off the syringe. Be careful not to touch the needle end. The needle is sterile. Pull down on the plunger to 1 milliliter so air fills the syringe. Inject the air into the vial and pick up the vial. This allows equal pressure in the vial bottle to obtain equal medication into the syringe. Turn the vial upside down while holding the syringe so the syringe will not come out of the vial. Pull the plunger down for the medication to fill the syringe at 1 milliliter, and then remove the syringe from the vial and recap the needle carefully. This is the only time you can recap the needle while at the med cart. Check to make sure there are no air bubbles in the barrel of the syringe. If there is air in your syringe, hold the syringe upright 90 degrees, tap the syringe gently, and the air bubble will go to the top of the syringe. Take off the cap and push upward on the plunger to release the air bubble out. Make sure you have the right amount of medication in the syringe after. Replace the cap over the needle. Apply clean gloves. Select appropriate site for injection. Please refer to the end of this video for information about correct injection sites. Palpate for masses or tenderness. Hold the syringe in your dominant hand, take off the cap. Make sure the bevel is upward. Hold the alcohol pad between your ring finger and thumb. Using your non-dominant hand, slide the muscle aside using the side of your hand and hold the muscle in place. This helps the medication to be injected deep into the muscle. Cleanse the site with alcohol pad in a circular motion. You can lay the alcohol swab near the site. Inject the needle using a 90-degree angle. This ensures the medication is deposited into the muscular layer. Stabilize the syringe by utilizing your index finger and thumb on the non-dominant hand without letting go of the muscle. Using your dominant hand, pull back on the plunger and check to be sure there is no blood in the syringe. This ensures that you are not in a vessel and you are in the muscle. Press the plunger slowly to inject the medication and wait 10 seconds. This allows the medication to disperse and decrease discomfort. Withdraw the needle and let go of the muscle and press the alcohol pad over the injection site. Do not massage the area. It could cause the medication to leak out from the muscle. Activate the safety guide with using your thumb to cover the needle. This prevents you from being stuck by the needle. Discard needle into needle sharp container, putting the needle end first into the opening. Remove gloves, perform hand hygiene, and document both of the medications given. The signature should contain the time, 0900, the person's name, Sharon Polano, title, SN/NCCC/initials, SP. This identifies who gave the medication and the initials. X out of the screen using the red X and do not save.